what I took away from a lot of what Chelsea said is don't trust what you hear on the radio or the TV. Go and investigate yourself. And I guess that's the message we can send to our friends, our neighbors. Don't give up. Go find out. And of course, that was sort of the basis for tonight's meeting. Don't give up on things. Find out about them and get the information that you need. As you know, this forum is sponsored by the White County Democratic Party and the 9th Women's Group, the 9th District Women's Network. And we had to have at least one, can't call him a politician yet because he hasn't been elected to anything, a teacher who wants to make a difference in the questions that we're talking about tonight. This person has put himself out. He's going to run for the run as the Democratic candidate for the U.S. Congress, the 9th District, that is held right now by a Republican who lives down in Gainesville and occasionally talks to people. His name is Doug Collins. But we hope to be able to, after next year, introduce our congressman up here, and it will be Josh McCall. And so, Josh, if you would come forward and talk to us maybe about the political side of tonight's topic.
Thank y'all. So I've got some good news and bad news tonight. The good news, there's only one speaker between you and your warm home. But the bad news is that speaker is a Latin and biology teacher. So I'll try to make this brief, though, because I know that I'm the last one. I want to talk tonight about a very serious topic. And before I get started, I want to disagree with Chelsea about one thing. She said if our politicians are smarter than her. I have been following politics, and in fact, some of those politics have been presidential politics, and I can assure you that you are a lot smarter than most of our politicians. So I just wanted to disagree with it. I don't want to say anything controversial, but I do disagree with you on that. So the question that we have tonight, and also before I get started on my solutions, such as they are, I want to thank our law enforcement officers over here tonight. I don't think we've given them a round of applause just for doing what they do every day. Because I really believe that every problem that we have as a society, every problem that we refuse to acknowledge as a nation, law enforcement officers have to face the consequences of our failures. As Mitch was saying, they are there to put a Band-Aid. They are there to as a dam between what is a really fearful and bloody tide that is spreading across our nation. And all they can do at this point is slow the bleeding. But they do brave work. They do work that you and I do not have to face every day. Dead bodies, informing family members about deaths and addictions and arrests. So I really appreciate the work y'all do. And I also appreciate we have some nurses in the room as well. And if there's another place that our problems as a nation are heading, if it's not law enforcement, it's often into the emergency room. So I know that there are some nurses here tonight. I know Brian is a nurse, and he made it out. I don't know if there are any other healthcare workers here tonight. Any other healthcare workers other than Brian? There we go, June. So we have several healthcare workers here tonight. I want to thank y'all too for y'all's good work and on these front lines. So the question that we're facing as a nation, it seems very complicated. I was reading a few things in the tax bill that are being introduced. Now, of course, we haven't had a single day of debate or committee on a tax overhaul of several $1 trillion of our economy. But now they've had to publish it finally, and we can see it. It's very complicated, and I haven't had a chance to read it. In fact, nobody has, except for a few people who've been crafting it behind closed doors. But one of the things that I just read about a little while ago, if you own an airplane, good news, you're going to get a tax cut. So there you go. Now, if you work at a factory that builds those airplanes, that's bad news because you do not get a tax cut. I'm sorry for those people. Also, if you own a golf course, does anybody know anybody famous that owns a golf course? Anybody? Well, if you own a golf course, believe it or not, I know that when our representatives were sitting down and thinking, what people in this country are struggling with tax burdens? I know that the first people on their minds were those poor, hard-scrabble golf course owners, because that, too, is in the tax bill. Now, I don't know all the other tax goodies that they're giving away, but those are a couple of updates on the tax code. We'll have to look at it now that it's finally been unleashed to the public. But the question that we're facing, which is a moral and political question as a nation, is how much exactly is one human life worth? How much is it worth? And there are two sides to that question. On the one side, we have what Mitch was talking about earlier, drug dealers who are willing to sell that life with profit. Now, there are small-time drug dealers and there are big-time drug dealers. I've had to do some pretty depressing research in preparing for tonight and facing this crisis that we're all facing as a nation. And some of that research has included what the big-time drug dealers did in the early 2000s, in the late 1990s. In the late 1990s, there were commercials sponsored by Purdue, not the person, but the pharmaceutical company, which said that these opioids that everybody had before been afraid of, it was a myth that these opioids were addictive. These were actual commercials aired. And you would think, well, that must be grounds for a lawsuit, right? If a company that is selling opioids to doctors as a solution tells you something that is contrary to medical fact, we should be able to sue them, shouldn't we? There's a problem. They had done their homework because they have a lot of people working for them. They had found this fact in a footnote in a letter to the editor in the New England Journal. That's right. They could not be sued because they found this assertion about opioids not being addicted in a letter to the editor of the New England Journal. That was the basis for that claim. But as many of us do know, opioids are extremely addictive. It takes people that, of course, we have stereotypes in this country about drug addiction, and those are unfortunate stereotypes. But if there's anything that breaks our stereotypes to pieces, it's the opioid crisis. There are people, as they say on the news now, people that you would not think would take these kinds of opioids who are addicted. I will tell you about my own experience. I had 2 herniated discs in my neck. And I grew up in a very simple childhood in a very rural area, Martin, Georgia, which is on the line between Stevens and Franklin County. And I can honestly say that all the way, and I also went to church, and when I was young, and I'm still consider myself a very religious person. I go to church, and I had never in my life seen pot, anything. I had not even seen pot. I especially had never seen heroin or cocaine or anything in real life, on TV, but never in real life. But we are facing this crisis now. Now in Martin, you didn't really have the same sort of reputation, right? If somebody in Martin took drugs, back then, of course, it wasn't as common among young people. And so where I went to school, if somebody took drugs, they were sort of, on the outside of things. But there are people who are living in your neighborhood right now. And I would wager that several people in this room have family members who are hooked right now, and that it's affecting their family. Well, I had 2 herniated discs. I had never done any kind of drugs, ever, and except for trying a couple of cigarettes out of my dad's Marlboro pack when he was, when I snuck a cigarette. So I went to a doctor, and I really needed some help. I had acute pain. I could not function. I couldn't sleep. I couldn't move. And he did an MRI. I was prescribed a 6-week course of Loratab. And the first time I sat down and took a Loratab, it was fortunate because I was actually watching a children's show with my youngest daughter, Abby, which fit really well with the feeling that came next. I had never in my life been high, but now I felt that high for the first time ever, and I thought, even in this first time I'd ever done any kind of drugs like that, I thought, what if a person took this and they were depressed? What if a person took this and they had really bad family problems, or they didn't have a job? What if they weren't in my situation? I have a very happy family, a very happy home life. I have a lot to live for. What if? So I took the course of medicine, and it worked. That's one thing we don't need to lose sight of in this debate, is that we don't need to take a tool away from doctors for when it is useful and necessary. We definitely do not want to do that, because pain is a very real problem in a lot of places around here. If you have diabetes and neuropathy, if you have cancer, and you're dealing with nausea and pain, there are very serious, painful conditions that really do need a prescription of an opioid. So we don't want to lose sight of that. But then my last dose of Loratab came, and I finished. The next day I was glad to be off of it because, I had heard the horror stories about how easily addicted people become, and I thought, well, I'm good. I feel okay. The last night passed, and then the next day came. And it was the summer, and I thought, how in the world do I have the flu? I talked to my wife, and I said, I swear I have a fever, and I'm not even in school. I'm a teacher, and I'm not around my bags of germs, also known as my kids, all day. There's no way I have the flu. And I started researching, and sure enough, I found out that little country boy from Martin, never done drugs before, was having withdrawals. That it can actually mimic flu-like symptoms. And I was on a very low dose. And I suffered through a day or two. I was sweaty. It actually invents pain. It forces your body to invent pain that is not organically there, but it's there now because that medicine, that drug has been working in you for so long. That's my own experience. There was a worse experience from a woman who attended our church. I won't share her name tonight, but she was a mother of children, everything to live for, happy home life. She was in a car accident. She was prescribed opioids. She became addicted, and one day she went down for a nap and she never woke up. Since I have been speaking tonight, several people have died from opioid overdose in America. Every 30 seconds, an American dies from opioid overdose. Now, I am a politician, but I try to focus on the positive most of the time. I believe that a lot of the problems in our country can be solved if we decide to come together and have discussions and dialogues. But this makes me mad. Because do you know what we've done about our opioid crisis? Now the sheriff and Mitch here, they do a lot all the time, locally. But our nation, our government, do you know what we have done to confront the opioid crisis? Not a damn thing. Nothing. So I ask you again, what is one human life worth? The one that died 30 seconds ago. How much was that life worth? Because on the other end of that, of Purdue and the companies, when we go to the hospital and we try to get treated for these, many people face a difficult choice. They have to choose between saving their life and saving their livelihood. If you go to the doctor today in America because of pain in your chest or a lump in your breast, you could very well risk losing every bit of your savings, losing your home, and of course you won't be able to pay for your health insurance anymore. All because we as a nation have decided to continue with the healthcare system that has a lot of gaps. And through that gap falls real human beings with real human lives. Nobody in this country, the richest nation in the history of the world, should die because they're poor. and nobody should be going poor because they're dying. That's my fundamental belief. There's not a lot that would get me out in public and run for office, but that will do it. My vision for the future of this country is that every single American, by right, has access to life-saving health care that would not only save their lives, but relieve them of needless anguish, whether physical or mental. The thing about pain and addiction is that they're very similar. Pain and addiction can both make you lose who you are. I've talked to many people this week preparing for this speech. Some people who live with chronic pain, and some people who have gotten through addictions. And both of them had one common theme. Your pain or your addiction makes you a different person. It takes over your personality. Now, I teach Sunday school over at First Baptist every Sunday, and we study passages in the Bible that talk about demon possession. And if there is one thing in this country that looks a lot like the demon possession that happened in the New Testament, it always happened not in the middle of Jerusalem where the wealthy people lived. It always happened out at the edge of society, the forgotten people. You will not see many of these people in the headlines who die of opioid addiction. It's not as dramatic as a Donald Trump tweet. It's not as scandalous as a Hillary Clinton email. It is a silent, very undramatic, very grisly killer. One thing that I think could help us is Medicare for All. Having a path for every single person, no matter their situation, to go and get treatment for their pain and for recovery from addiction. And we can look at the history of these things. They have a spike and then they have a drop-off. Every time a new drug comes through a modern country, there's always the same sociological phenomenon. It goes up and up and up, and then there's a spike, and then it starts to fall down. Now, if our only solution, as Mitch mentioned, if our only solution is arresting those people, we already have more people in prison than any other country in the world. It's not their fault. They're enforcing the law. It's our fault. It's my fault. I haven't done enough to solve some of these problems. We as a nation have not done enough to solve these problems. So what should we do other than Medicare for All? There is another option. There is a drug, a medicine, that is available, widely available, easily produced, that it is illegal for our doctors to prescribe in most cases in this state. 83% of all Americans agree that this medicine should be available through a doctor's prescription. 83% of Americans can't even agree which way is up. But they all agree that this medicine should be an option when you go to your doctor. That doctor should be able to prescribe cannabis. 83% of Americans. Can you imagine? We always wonder, what can Americans come together over? Apparently, it's pot. But how could we do this and how could we manage it? Because, it's not a wonder drug. It does have some risks. It can affect your brain and your brain development. You can't drive on it. And a doctor should be able to tell you and give you advice on, how to dose and how to take this. But I have read of many doctors who have been staunch opponents of medical marijuana who have changed their mind because they have seen real cases where people were living in dire pain and taking medical marijuana because of their pain, especially cancer patients. Cancer patients with severe cancer issues like pancreatic cancer, who deal with nausea and chronic pain. Many of them who have taken this have said that it has revolutionized their lives. They can still be them. They can still be who they are, maintain their identity, and deal with the chronic pain and nausea that they suffer from because of their medical conditions. People with diabetes, people with many types of seizure. And you may not know this, but our state has actually, the legislators, most of whom are not doctors, sat down and came up with a tiny list of issues that if you have them, you can legally be prescribed cannabis in the state of Georgia. But these are non-doctors telling us a list of things that should be prescribed by doctors. I think that that should be a doctor's choice. But they can't really do it because marijuana is on the same schedule as heroin and LSD. In our war on drugs, which we started in the late 70s, early 80s, instead of doing what we're starting to do now, thinking of addiction as a medical issue instead of a criminal issue, when we started that, they decided to put marijuana up on that first schedule. So the FDA cannot approve many of these tests in many of our universities, who also cannot order this marijuana to be used in tests because it's on the Schedule 1 and they have to deal with the DEA to actually do testing. So they can't even test it. I believe that doctors should have one more tool in their box, a less addictive tool with fewer side effects that 83% of Americans agree should be available to doctors to prescribe. But I'll tell you why I think that we don't already have medical marijuana. Number one, where's the profit? Greed. If you pass medical marijuana as they did in Washington, a doctor could write you a prescription to give you permission to grow up to 3 plants in your home. No trips to the pharmacy for your pain medicine. You are in control, not Purdue. Do you know who spends more money on lobbying than any other industry in this country?
Yes.
It is not war. It's not the NRA. It's the healthcare industry. Drug industry especially. The number one. They wrote these laws that eased up on restrictions for opioid prescriptions, and they also make sure that their representatives, they're not yours or mine, their representatives write the laws they want written. They don't want us to have control over our own destinies. So you're going to hear something a little weird from a Democrat tonight. We are not conservative enough. The government has overstepped its bounds. If you have a prescription from your doctor, you should be able to grow a plant in your own home on the advice of a doctor, telling you how to dose yourself with this plant to save you money. And I know this is revolutionary, but it's a few hundred years after our revolution. I think it's time to say it. Get control over your own body back from the government. Is this really revolutionary in 2017? That's my other solution, other than Medicare for all. But it's a very complex situation. I think finally what we need is at the state level, we need more community collaboration because it takes a job. If somebody doesn't have a job, guess what they're going to think about all day when they're trying to get over this addiction? They're going to think about that drug. They've got to have a job. What are we going to do about jobs? Are they coming back yet? The carrier plant that Trump promised to save, they signed a big tax giveaway for them. And guess what they're doing to the jobs now that a few months after the headlines passed? They're cutting jobs again. There are a lot of people here who can't find jobs. What are we doing about those people? We have to have a whole community effort, faith-based effort, churches. What are they doing? Are they getting any help from the government to offer people a path out of, and training to help people get out of these addictions? So those are some of the issues I think that we can work on as a country, as a nation. And those are 2 of my solutions. And of course, none of them are silver bullets. This thing is only going to get worse before it gets better. That's what every sociologist will tell you. It's going to get worse before it gets better. But it is our duty as a nation to make sure that we look after our neighbor. If we do not look after our neighbor, what good is it to call ourselves citizens of the same country? Thank you for listening to me tonight, and I look forward to your questions. And you guys are a lot better than my biology and Latin students that are high school boys. You are so much better students tonight. Thank you for your courtesy and for your attention.